Hello, everyone, and welcome to day 2 of the Youth Health Financing Forum 2026. We would start very soon. We are just waiting for more participants to join in, and then we'll start immediately. You are welcome. Okay, hello, everyone. Welcome once again to the Youth Health Financing Forum 2026, day 2. Yesterday was amazing. We had a great time, and today will not be any different. So just to have a brief recap on what we have been doing, the theme for this year is the theme for this year's Youth Health Financing Forum is accountability, equity, and action, youth powering the next phase of Nigerian health financing reform. And over the course of 3 days, we've done 2 days. On Thursday, the 23rd, was the pre-event workshop. And yesterday, which was day 1 of the conference, the theme was assessing progress and showcasing youth innovation. And we had a spotlight talk showing youth perspectives and advocacy work session, where we had our budget for health fellows and youth leaders. The person of Muhammad Kabir, Dr. Shakirat, and Ibrahim Badmosi, and they all gave us perspectives to their projects under the Budget for Health Fellowship. And we had an amazing time. We had conversations from the question and answer session, and it was indeed a showcase of youth perspectives. We also went on to have presentations from our partners, our esteemed partners, from WCA Health, in the person of Dr. Ufoma Festus Omobi, and from Budgets, from Dr. Biobele Davidson. And then we had a brief Q&A, and then we had the main meat of the session, which was a keynote address from our keynote speaker, Dr. Ifeanyi Nsofo. And I believe that yesterday was an amazing session. And today will be not any different. So with emojis, let's just give a round of applause. Let's use to show our excitement for day 2 of the Youth Health Financing Forum. We're all welcome, we're all welcome, we're all welcome. So for today, which is the second day, the theme is from advocacy to action. And over the course of these sessions, we'll have a panel session where we'll be listening to youth leaders and our amazing panelists that have been well prepared for these sessions. We have 2 panel sessions. We'll have a panel session, we'll have a Q&A, then we'll have a break, we'll have the second session, and then we'll have presentations from our esteemed partners, Code, and then from IBP, and then we'll have the lunch session. So I hope we're ready and prepared for the event. So we'll begin very shortly. All right, we'll be starting the first panel session. And the theme for this panel session is from recommendations to results, tracking the implementation of health financing reform. And the topic is youth perspectives, advocacy, and citizen accountability. So over the course of this panel session, we'll be listening to various panelists sharing on this topic, listening and getting their ideas for the topic. So young people constitute a significant proportion of Nigeria's population, and they're disproportionately affected by gaps in health, access, and financing. Yet they remain the most one of the most powerful and often underutilized forces for change. So youth-led advocacy, digital innovation are increasingly shaping how health policies are designed, funded, and implemented. So in the next 45 minutes, we're going to examine how youth-led advocacy is influencing health financing reforms. We're going to explore practical approaches to strengthen citizen accountability. We're going to highlight the role of digital innovation and community engagement in advancing transparent and accountable health financing. And we're going to identify opportunities for institutionalizing meaningful youth participation in health financing policy making and implementation. We have an excellent panel that's bringing diverse expertise and lived experience. And without further ado, I'm going to introduce them and then we're going to start the session. So the first on my list is Muhammad Issa Jafar, who is a health policy and youth advocate, and also the former FAMSA, which is Federal African Medical Students Association president. I also have, please let's use our emojis to welcome them, to celebrate them. Thank you. We also have Abdulaziz Abdulmalik Husseini, who is the acting head of programs at Connected Development Code, who's also, Code is one of our partners. We appreciate it. Thank you so much for joining us today. We also have Yusuf Hassan Wada. Thank you also so much for joining us today. So I want to confirm that all the panelists are on the call now so that we can begin. So Mr. Mohammed, please, are you on the call? Mr. Hassan, are you on the call as well so that we can begin?
Hello, moderator. This is Muhammad.
Oh, thank you very much for joining us today. You're welcome. Please, can I also confirm that the other panelists are on the call as well?
Yeah, good evening to you all. Abdulaziz Abdulmalik Husseini from Connected Development. Thank you.
Thank you very much, sir, for joining us today. You're welcome. Please, can I also confirm that Mr. Yusuf Hassan Wada is on the call as well?
Yes, I'm on the call. I was just trying to. Okay.
All right. Thank you. Thank you all so much for joining us today. So we'll begin the panel about now. And the objectives for this session, as I've mentioned earlier, is to examine how youth-led advocacy is influencing health financing reforms. We want to explore practical approaches to strengthening citizen accountability. We want to highlight the role of digital innovation and community engagement in advancing transparent and accountable health financing. And we want to identify opportunities for institutionalizing meaningful youth participation in health financing policy making and implementation. So to all participants, you are welcome to this panel session. And the first question to all panelists will be, in 1 minute, what role should young people play in ensuring health financing reforms translate into better health outcomes? So in 1 minute, what role should young people play in ensuring health financing reforms translate into better health outcomes? I'd like to start with Mr. Mohammed. Please, you can go ahead to answer.
All right. So please, if you can help me confirm if I'm very audible.
Yes, you're audible.
Okay, amazing. Hello, everybody. Good evening. My name is Muhammad Isa Jafar, as introduced, and I am excited to be part of this initiative put together by EcoCare Strategist. It's important, and I believe as a continent, as we continue to push for health security and sovereignty, these initiatives are very important as it tries to put the young people at the center of the conversation. So to answer your question on the role of young people in health financing reforms, first of all, I would like to give my own understanding on what reform is. So for me, reform is basically the set of policies, documents, actions, and programs that are put together to be able to revamp or upgrade an existing system that seems not to be working for us, not to be addressing our own problems, right? And I'd like to mention that these reforms are usually brought by organizations like ministries, like continental organizations, global organizations like WHO, to be able to address health challenges that there are. So what are our role as young people? First of all, I would like to mention the first and most important one to me is as young people, we need to actively learn about these reforms because you cannot be able to advocate and promote what you don't know, what you are not fully aware of. So that is very important because as we continue to go on the internet, on social media to talk about advocacy, but we are not very much aware of the reforms that are there. How many of us are aware of the Africa CDC's AHSS agenda, the Africa Health Security and Sovereignty agenda. Please, if you are aware of such strategy, can I see your hand up? I just want to take a quick survey. No way, there is no hand. Okay, so because of time, yes, we need to stay informed on these reforms and we need to know who is responsible for what, who needs to do what. And then thirdly, leverage on our competitive advantage of number, energy, and influence the public's sentiment such that it will compel the government or whoever is responsible for such a reform to deliver his or her mandate through meaningful assemblies, awareness initiatives, and demonstrations. So these are some of the roles that I think young people can be able to play in pushing reforms to realize good health outcomes. Thank you.
Thank you very much, Mr. Mohammed. Please, we can use emojis to give a round of applause. I would like to move on to Mr. Abdulaziz Husseini. I hope I'm pronouncing it right. Please, you can go on. Thank you, sir.
All right, thank you very much, and good evening once again to everyone. With Nigeria having one of the youngest population across the globe, I think, and with our limitation in terms of access to basic amenities, as well as the lack of transparency and accountability that has been so entrenched in our system, at this critical juncture, it is quite important for youth to become vigilant, for you to become very curious, because these are some of the ingredients that drives realistic questions, which puts the government and the various institutions of government in check. Otherwise, they believe that these people are not watching, these people do not understand what is happening. And just like Muhammad says, when you talk about vigilance, it cut across a lot of things, monitoring the budget, understanding the policies, understanding the modus operandi of the health sector as a whole, and all of the different policies that govern it. This is the role of the youth at this critical moment. Otherwise, we'll continue to cry and we would never get a solution to the problem. Thank you.
Thank you very much, Mr. Husseini. Mr. Yusuf, you can please go on to answer.
Okay, just to be sure, can you hear me? Hello?
Yes, we can hear you. We can hear you.
Okay. I think I wouldn't like to say what other speakers have said, but looking at what Nigeria is actually happening, just to highlight a key important thing, Nigeria does not have a policy problem, I think. What we really have has actually been an implementation problem. When you look at strong policies and frameworks we have the Nigerian Health Act 2014, we have the BSCPR, we have the NHA Act, we have even now the government bringing health sector renewal investment initiative and also sector-wide approach. For me, I felt it's actually how do we translate those commitments into better policies. It's actually the first key thing. And basically, how do we do that? It's actually to see how do we make those recommendations that actually reach those impact to facilitate and also how to improve patient care. The other thing is sometimes we look at it in the sense that we also don't have a money problem. Health financial reform has actually been situated around things that doesn't matter. Maybe how do we allow money not to sit at actually the higher level, for example, at the federal level or federal ministry, but how do they reach the facility level? We're looking at how do they reach those frontline workers? How do we improve outcome? So those are key things that we actually need to look at. How do we also ensure that, for example, basic healthcare provision fund money are actually going in? So how do we do that? So how do you ensure that even counterpart funding are actually released? How do you ensure that even out of pocket spending, which is basically too high for low income people, how do we do that? So those are key things I felt will really leapfrog even universal healthcare coverage as we talk.
Thank you very much, Mr. Yusuf. So I would like to start with you again. So this question is just for you. You have worked at the intersection of research, policy, and advocacy across Africa. So despite growing evidence of what works in health financing, why do many good recommendations still struggle to influence government's decisions? And how can young researchers and advocates communicate evidence in ways that policymakers are more likely to act upon?
Okay, thank you so much for that important question. And basically, it's actually how do you connect policy research, which is actually evidence, and also how do you connect with actually main implementations across board. So I think the first key thing is actually even starting with policy research or evidence. Because majority of the evidence we generate, we have one of the most important data across the world. But the level of scalability is actually not really there. And basically, we don't use that for evidence, that evidence for decision making. So just example, I just came out from a meeting, and basically we are discussing around, when you look around our primary healthcare activities, are really different from reality that we face. For anyone on this call, the first key thing that he could recognize is that when your brother, your mother, or someone in your community actually not feeling fine, we have abandoned those healthcare facilities to actually find what we call the chemists, the PPMs, to actually go there. But the conversation is actually situated around that. Even the community pharmacy and PPMV, which we call chemists, they are not recognized in what we call the formal primary healthcare. Because, for example, today, someone has cough, catarrh, malaria. We should have a digital health system that can capture that you have given someone, for example, artemether lumefantrine, so that when he actually come up with actually resistance or other things, you can communicate his data to the secondary level. So referral system is actually very weak. We have copied a referral system that is actually situated for developed countries. For developed countries in the sense that, you actually go to a general hospital, for example, because PSC doesn't work. They tell you that, they have take this. If you are going, for example, to a teaching hospital, hardly your file goes there. So we need to embrace that evidence to actually shape our policy. I think that's the first important thing. The second important thing is actually around the nexus of what we call policy research and also implementation. We actually, like I said, we have beautiful policies that today doesn't really answer our implementation. For example, there's something I call inverted triangle. Basically, when you see a triangle, the tip of a triangle is actually where the smallest part is been. But that's where primary health care is actually at the moment. The ministry or even tertiary level expenditure actually happen at that level. So we are talking around infrastructure, we are talking around workshops, we are talking about maybe capacity building, but not people at the service delivery. So you won't have that, you continue to have that implementation gap because people at the topper end, which is supposed to be at the bottom of the triangle, are not there. So also when you look around how I said we have beautiful policies. For example, when you look around the basic healthcare provision fund, we have 1% of all the money circulating in Nigeria, revenue coming to Nigeria, saying that 1% is going to the healthcare sector. But basically, like I said, we have that money, but it's not dropped down to community. If today we have 100 naira to be spent on health, I'm assuring you that maybe 30 to 50% is actually going to tertiary or even what you call the whole administrative fee. So those are key things we need to discuss. And when you look around, for example, we're talking about health financing. We have a policy, for example, we are very happy the president mandated that actually Nigeria health insurance is mandatory. But who is mandated? Because when we designed that policy, which I was part, we actually thought the government would put a lot of money on what we call the vulnerable group fund. What vulnerable group fund means is that Nigeria, there's a benchmark for who is the vulnerable. And World Bank came to us to say, we have 130 million people that are vulnerable. So we thought that, for example, basic healthcare provision fund will be paid as insurance for those people so that the other people can be mandated. Because today, if you mandate people to pay insurance and you are not taking care of people who don't have anything to do, you're actually doing nothing. So how do you improve those access through insurance, which is actually the surest way to achieve universal healthcare coverage. So we need to also look at all those nexus. So how do you use evidence? If evidence say we need to spend ₦1, is it applicable to us? So those are key things I felt we need to discuss or we need to leverage upon. So over and thank you.
Thank you very much, Mr. Yusuf. Quite interesting conversation. I have follow-up questions after, however. So onto Mr. Abdulaziz. Connected Development Follow the Money initiative has become a global example of citizen-led accountability. A global, what lessons from this model can strengthen accountability in Nigeria's health financing sector? And how can communities effectively monitor health budgets at local government level?
Thank you very much. And once again, I'll still come back to the issue of youth. If there's any arm or group of individuals within Nigeria today that could actually enforce or push or drive for the enforcement of our policies, including transparency and accountability, it is actually the youth. I'll tell you again for free that if there's anywhere or if there are any places where government funds could easily be siphoned, it is actually in the health and the education sector. This is because these things happen, are basic amenities that are required by the people, even at the most remote area. But because these people do not understand the workings of the budget of government, do not also feel that they have a right to ask the people at the helm of affairs how these resources have been utilized, if they've received them. Because in some cases, we find out that even at the local government level, they are yet to receive some resources that the people should even question. So over the years, we've tried as much as possible to empower marginalized communities. And when we say marginalized communities, we mean those communities that lack the information about what government ought to be doing for them, by equipping them with the necessary information. And that is why at Follow the Money, we have also come up with what they call the Fact About FAC. Fact About FAC is our weekly instrument where we try to break down per local government in the country what has been allocated for that particular month. So we do a total breakdown of how much the FAC has allocated to all the tiers of government. We share this back with our state leads who are at the state level and also have their coordinators at the local government level to be able to hold their government accountable. It will interest you to know that the government at some state level begin to question these people. Where did you get all of this information from? And the moment we hear such questions, we begin to realize that we are doing the right thing. It is not a sign for us to say, oh, you know what, you have to be careful, don't do that again. No, it simply means that the government is being asked the thorough question that they've not been asked in the past. So the role of the youth, as far as accountability and transparency is concerned, cannot be overemphasized. Follow the Money has come up with a model where we believe that if all citizens become very much aware, follow the budget right from when it was passed, or even before it was passed, to when it was passed, to its implementation, the government becomes more careful with the spending of resources. Now, adding another flip to this is the reform in the tax law of the country. Now you are asking more people to pay taxes, but before the taxes, there were revenues that were generated. The political elites never or at any point in time complained about having access to quality health. But with the new tax reform, the government is saying that if Nigerians want good health system, they should ensure that they pay their taxes. With the heavy loans that have been taken by the government, Follow the money is asking, and this is what all citizens should be asking. We are taking the lead, and we are also ensuring that community members also understand why this should be done. Otherwise, the number of medical practitioners that have left Nigeria in the last 2-3 years is only a tip of the iceberg compared to what will come in the nearest future. We will lose our health professionals. We will lose welfare for the ones that remain at home. We will lose their focus and attention because they are no longer motivated. And before you know it, our healthcare system becomes a quagmire, becomes a thing of mockery and a death trap for Nigerians who can no longer afford or even have access to quality healthcare. And I tell you, the final phase of it will be our people reverting completely back to herbal medication, self-medication, which again is another trend of a disease outbreak, pandemic that we might not be able to curtail, except if the citizens have agreed and have surrendered to government that yes, we are waiting for when you will finally dig our graves and bury us. This is the right time for citizens to continue to follow the money. And this practice has shown results across board. On the Basic Healthcare Provision Fund, in just some few weeks back, we were able to also reveal some of the lacuna in the implementation of that particular mechanism. So all of this can only work if all of us become vigilant and become transparent and we inquire and we are curious. Thank you.
Thank you very much, Mr. Hussaini. That was quite an insightful comment from you. I would like to move on to Mr. Muhammad. To having represented young people in national and international policy spaces, what practical strategies can youth organizations use to influence health financing reforms beyond social media advocacy? Mr. Muhammad.
Thank you very much for that question. I think my opening phrase would be to borrow the phrase from the previous learned colleague who has just shared some gems there. Follow the money. First of all, I keep mentioning this. You cannot advocate and promote what you are not aware of, what you don't know. The first thing to be able to have such influence by young people so that we can be able to influence health financing reforms beyond social media advocacy, right, is staying informed. You have to know about these policies that guide Nigeria's healthcare system. The learned colleague on the panel that made mention of some of the policies, some of the Nigeria's healthcare policies, the National Health Act, National Health Policy, and all of those. How many of us do know of them? How many of them do know that they exist? Not even talk about going through them, getting to know what they are, and mentioning out what agency, what institution is responsible for what. We all hear about budgeting, the legislators having to approve budgets, and then ministries coming to defend them. Do we follow such news? Are we really informed on what's going on in the country? Because if we are not, then please, this conversation needs to be recalibrated. We need to go back to that, right? That's the first thing that young people need to do. And as organizations, I think the best practice is to invest in the capacity building of of organizations members and associations members like medical students, because I see the panel have a lot of those. We really need to invest in that. We need to invest in our capacity to really understand these terminologies, what they mean, what these policies are, and how they shape the healthcare system. We need to be able to understand the motivation and incentives of the key players in health. Why are let's say, for example, legislators not approving this budget on time? Why is this person not doing this? We need to really understand that, because that goes a long way to tell us the interest of the stakeholders that we are talking about. Another thing that young people must do to be able to really have the influence, to be able to influence health system reforms is form partnerships. From experience, I will tell you that young people really need to work in silos. I don't know why, but we tend to do a lot of work in silos. We have organizations, we have, let's say, the organizations of medical doctors, young medical doctors. We have that for medical laboratory scientists. We have that for pharmacists. We have that for medical students. All of this work in silos. Nobody wants to come together to have a unified voice. And I think we need to wake up to this slumber. As young people, we must come together to have a strong voice. Wherever we speak the same language, we advocate for the same thing, we have the same talking points. Because if that is not done, we'll continue to work in silence and our voices will not carry the weight to be able to influence health financial reforms. Having represented young people in national and international spaces, I would tell you that I have personally experienced young people, not really taking advantage of some of the opportunities like that. When we go outside there, young people do reach out to individuals that have the influence to be able to influence certain things. And what we end up doing is just to get pictures for LinkedIn content. I find that very hurtful personally. Like, I don't understand the point where someone is gonna sponsor you to travel to go into these big organizations, into these big influential spaces, but then you end up getting some pictures for LinkedIn, Twitter, Instagram content. Come on, we can do better. We need to network meaningfully. These individuals that we are meeting, they have the influence, their voices carry weight. Some of them with a single tweet can be able to alter some policies. Right, so we need to really demonstrate value to them. We need to tell them, we need to show them that we know what we are doing. All right, we know what we are doing. We demonstrate value and we show quest for impact, not just those Instagram and photo shoots for LinkedIn content. I think it's important because when you build strong networks, that's when you can be able to really influence whatever reform you want to see happen. And then also, many a times I see young people advocate using social media sentiments. They are not really talking with evidences, right? It's very important whatever young people want to do should be backed up by evidence. We have the numbers as the panelists that started to talk about the demography in Nigeria. Nigeria's young people constitute 60% of the country's population. That's about 150 million. That's a lot of number. But then we are not taking advantage of that. We're not generating evidence. We are the closest people to the community. If we want to generate whatever evidence, whatever data we are, it's very easy for us to be able to do that. It doesn't have to be some very complex and costly, expensive research. We can be able to generate some data that whenever we're speaking, we'll always reference it to that data, and that would carry weight. Because trust me, whenever you go out there as a young people, the first impression is not about trust. You are seen as a young person. You're not seen as an expert. You're not seen as someone that knows what that person is doing. You're not seen as someone that knows the field of what you're talking about, right? So you have to go extra mile to prove to people that you know what you're doing. You know what you're talking about. You understand the terrain. You understand the system. And when you begin to speak, people would know whether or not you know. So we need to really go into evidence generation. So as organizations, I keep citing examples of organizations like NIMSA. We need to invest in doing that. We need to go into our communities to collect some data so that whenever we're speaking on what, we can be able to back up our statements with evidence. And then also, very importantly, sometimes young people want to complain rather than take initiatives to solve our own problems. Say, for example, we also want to talk about not being invited to spaces, not being sponsored, not being taken there, not being given a seat. Well, that is true, right? But however, what are you doing to solve that? What sacrifice are we making to put our foot into those spaces so that we can be able to share our perspectives, right? So it's important for us to be able to identify influential convenings, influential spaces where these conversations do take place. And if you're not given a chair, take yours there, go and sit there, talk to people. And when you have content, people will listen to you. So it's very important that we also take initiatives where we can be able to meaningfully contribute. We don't have to wait until someone give us that invitation. Yeah, it will be cool. And it's important if we're talking about meaningful youth engagement, we should be invited to such spaces, right? But then if we are not given that, we should do it ourselves. We don't have to wait until someone does it for us. And then I think the last thing I will be rounding up with on how young people can truly influence health system financing reforms is investment in our communication, advocacy, negotiation, and so many other skills. We as young people, especially in our university years, we tend to just accept the situation as it is. Whatever we are taught in class, that's it. Whatever is not taught, we think that it doesn't matter. It's not important. But what is most important is some of these skills, because sometimes what you say, how you say certain things is as important or even more important than what you say. So we really need to invest in such skills. We need to be able to learn these communication skills, advocacy skills, so that whenever you have any opportunity to meet these influential individuals, those in government, in legislative arm of government, those in institutions that they are implementing some of these programs, those in health insurance, everybody, because you are already aware, you are informed, you can be able to contribute and say things that would influence decisions that these decision makers do make. So until these are done, young people will continue to be social media ranters, which we really don't want to be, rather than true influencers that they are. So thank you, and back to you, moderator.
Thank you very much, Mr. Muhammad. I think a very important point you mentioned was the importance of networking, and not just networking, but networking meaningfully, because this plays an important role in influence. Also, in the investment in youth societies or youth organizations as well, to be able to teach proper skills or proper information about how to properly influence. Thank you very much. This brings me to my next question, and it's for all the panelists. Many young health professionals and students want to contribute to health financing reforms, but do not know where to begin. What practical advice would you give them? I would like to start with Mr. Mohammed. So please go ahead.
All right, amazing. So to be very honest, most of these spaces do not have a proper structure on where you start from. They don't have like entry level, or perhaps I don't know because of my limited experience, perhaps. But what I will tell you, this is where the opportunity lies. Start getting informed. Go and read those policies. Go and identify spaces that these topics like health financing is being discussed. Identify organizations, institutions, government arms that has to do with this, with health financing and reforms and whatnot. And that's how you begin. The moment you begin to acquire this knowledge, the moment you begin to become informed on these issues, and then you take yourself to such spaces where these conversations begin to are being discussed, then automatically you are taking yourself in there. And that's how you begin. You begin by knowing this space, getting yourself aware and informed, and then taking yourself to such convenience. And then before you know it, you will always be on an autopilot, and then you probably become an expert in health financing. So that would be my honest practical advice.
Thank you very much, Mr. Mohammed. On to Mr. Hussein. Please can go ahead.
All right, thank you very much. I know a couple of people will say the opportunities are not forthcoming, or they don't know where to get these opportunities. I can tell you for free that if you utilize LinkedIn a lot, you'll see a lot of these opportunities. Sometimes we want to start in events as speakers, whereas we could go there and start as attendees, network, like Muhammad mentioned, network meaningfully, begin to show workings, like we say, show workings, not be cho. You want to contribute, but you need to be able to show, like Muhammad kept mentioning, can you show the, what do you call it? your understanding, your grounding on the policies, for example, the financing structure. What are some of the sources for these finances, and what do you understand by how these finances have worked over the years? It will surprise you to know that this information is not in the public domain as I speak to you, and not even the government or even the health workers in the country understand that the MOU that the Nigerian government signed with the United States of America of about 5 billion USD to finance the health sector ought to be gazetted and to be made a public knowledge. But till this day, I don't know if they gazetted it this morning. As at yesterday, I don't think they've gazetted. So it's not yet a public knowledge. And this is something that the government ought to make known to the people, because they are using part of taxpayers' money to fund this counterpart funding. And now we know that the US government is bringing in resource. How do we ensure that the Nigerian government is paying its own part and not just taking the Americans' money as another resource to be squandered? So we need to ensure that we put ourselves out there, be in a cycle where we have this conversation, see gatherings where these conversations are being had, and then that way you are able to begin to understand and make contribution, and your voice become known. Today, I can tell you, I'm being invited by different organizations to speak around the health sector, not because I'm an health expert, but it's because of my interest in the accountability aspect, the transparency aspect of the funding to the health sector. And at that level, I'm already speaking at that. And today I'm managing a project on accountability of Gavi funding. This is around vaccination, zero dose children, hard to reach communities. These are what are the challenges with these people. So we need to also understand that you need to put yourself out there. You should understand the policies. You should understand the working of the sector you want to go into, but don't assume that you're going to start at the top. Don't assume you're going to start at the as a panelist. Don't assume you're going to start as a paper presenter. You might just be beginning as an attendee of the gathering, and you get to know people, ask very sensitive questions, and after the event, you try to do post networking. And these events are so numerous, because I know I've seen a couple of them online. So the moment we're able to do all of this, you begin to build your platform. It's not something you get overnight, or you just wake up in the morning, you just walk outside there, and then you say you already have a platform where you're already speaking about the health reform and financing. So please, we need to start somewhere, and we need to start humbly. But our voices are really needed. Thank you.
Thank you very much, Mr. Hussein. Please, on to Mr. Yusuf. Over to you.
Okay, thank you so much. I think a lot have been said, and I will try as much not to repeat what has actually been said earlier. For me, I felt one of the key challenges we actually need to understand as young people, and also when we go to reform, not health finance, but every reform, is actually to make sure that we actually go to the table with resilience. And basically, I'll give an example. If you know how, for example, how the tax reform went through, some will say no, it's not it. Some will say this is it. Some will say it will never happen. So those are reforms skills. I think that's the first key thing. Is actually you need to be resilient, because you might not get everything you go to the table, because a lot of issues will arise. I think that's the first important thing. I think we need to be clear. The second key important thing I would like to highlight is actually we need to actually go to any state with evidence, because the world has truly changed in the sense that any reform idea you are going, the first key thing any reform policy guy or anything, or even leaders, they ask for is actually what's the tax implication, for example, the cost implication. What's really the difference between what's really the difference between what is what someone is putting and what's really the cost effectiveness for a state or even as a nation. So those are very important things. The third thing I would actually like to say is we need to actually speak the language of the community or the people we're engaging. You understand? Because majority of times, last week we had a roundtable with commissioners of health, for example, which majority are even having a background. For example, they have a background for health. But the issue they actually has is people goes to the table. Oh, we are looking like we are people that would love to get money from the system, not really how to give. But what's really the implication? You are telling your governor, oh, you need to spend 1 trillion or 15% of your budget. How does it give him some political willpower? Or how does it even give him, for example, the leverage to say, oh, I have done the right thing? Or this is actually what would translate to even the whole economy. So those are conversations we haven't had. Because, for example, anytime a politician goes, the only thing that he felt is important to him is actually to say, oh, let's do infrastructure because he's actually trying to get something. But how are you putting to service delivery or even recurrent expenditure? He felt like, oh, those doesn't matter to him. What does he get in return? So those are key things. And the last key thing that just came to mind when the sorry when the follow the money person came in, I think the conversation has been more of accountability in the health reform. But most times, basically, what I see is actually sometimes even in the budget, people put them there, which I think is an advocacy I felt the follow the money can do, is that sometimes it's not really around how much is on the table. Because majority of time, oh, it's very clean, the health put there. But what's really the incentives? How do you also try as much to tell those guys that, oh, things are well or things could be better for the community, for the government to say, oh, we can fund it? Because there's an analysis I think budget did, which we just saw last week. Basically, you can see their health budget is not really been dropped down. You can see a lot of money, but we don't utilize it because even the leaders, for example, starting with, for example, the House of Assembly, they don't understand what health means for them. They don't understand, for example, House of Reps to actually use a TPA, those constituency project, to actually pay for insurance. They are reducing the burden and also accelerating universal coverage. So those are key conversations I felt as a community, as a young people, we need to actually go to those tables there. And lastly, I think the patience, we actually need to sometimes to be patient enough because sometimes we actually go to the table, oh, we didn't get this, then we stand up. We feel like, oh, this is the last bus stop. But reform actually, it's a whole lot. We don't actually need to stay on saying, oh, we have passed the basic healthcare provision fund. For example, there's a 2.0, but it took us like 3 years to actually get releases. And even not even 90% of those expenditure have been made. So those are key conversations we need to actually bring to the fora. So from me.
Thank you very much, Mr. Yusuf. I would move on to the last question, which is for all the panelists as well. And the question is, what should meaningful youth engagement in health financing look like 5 years from now? What should meaningful youth engagement in health financing look like 5 years from now? I'd like to start with Mr. Yusuf. Please go ahead, sir.
I think for me, meaningful youth engagement means not really tokenistic. How do we try as much as possible to bring young people on the table? So most times, even from where I work, I'm actually a young person, but I have been put on the table to even engage even the likes of even the presidents of so many countries and even all the processes. That's really what meaningful engagement means, because some of the challenges that affect young people, it's only young people that can solve it, or they can bring all those key things to the agenda. So those are key things we need to start doing, to bring them on the table, to be part of the conversation, and also to need to know what they are doing. The second thing is actually like youth are not just a back office. They are actually an integral part of the team. So most times when their challenges are being made, we shouldn't wait for people who are not young people to solve it. So we need to actually bring them to say, oh, this is something that they need to be there. And the last thing is actually to be patient with young people. Patient in the sense that we need to actually also bring them to learn. We need to co-create with them. We need to listen to them. And we need to also indulge them to say, oh, these are main part of them, and also bring them on board. I think those are key things I would like to chip in here. So over.
Thank you very much, Mr. Yusuf. On to Mr. Hussaini.
All right, thank you very much. And I'll be very brief. Meaningful involvement for youth in the next 4 or 5 years will be to say we see a lot of agitation, a lot of advocacies around cross-border collaborations in terms of having a unified health demand for Africa, increased domestic resource mobilization, because most of the epidemics or pandemics that happen and affects Africa is because Africa has been heavily dependent on donor funding, and very few countries have domestic funding mechanisms. Nigeria is lucky to have our own BHCPF. Not all African countries have this. When I talk about the MOUs that are being signed between Nigeria and the United States, a couple of other African countries rejected that particular MOU simply because of the challenges of data sovereignty. Can African countries speak in one voice towards this? And this is where youths need to be involved, including the AU, so that Africans can go out with a unified demand and not one country sabotaging the other part of the African continent. So in-house, back here in Nigeria, meaningful youth involvement will be to say we've seen a lot of youth coming into coalition, speaking with one voice, and advocating for seriously, and I mean seriously at this point, domestic resource mobilization, because we cannot continue to operate this aspect of neocolonialism that affects the integrity of the data of Nigerians, as well as affecting their accessibility to basic health care, which has in a very long while put the government in a very carefree or laser-free kind of position that they don't care about the well-being of the people simply because the youth are not asking the right and meaningful questions. But you can do this despite all of the intimidations and pressure that the government might want to use every of their tools at their disposal to do. You can achieve this if you belong to a coalition. So meaningful youth involvement would be to say there's a very strong coalition where youths are sincere, and this coalition is defined by a common ideology and desire to see a change in our health sector. If we cannot achieve anything in Nigeria, we should achieve good health financing, we should achieve good healthcare access, we should achieve good road and transportation means. If we achieve all of this, Nigerians are not asking for 5-star hotels every time. Thank you and God bless.
Thank you very much, Mr. Hussaini. Mr. Muhammad.
All right, thank you very much to our panelists. Honestly, myself been learning a lot from them because I think I'm the youngest of them, still a medical student. So I also try to speak for medical students and for other young individuals. Right. So for me, what should meaningful youth engagement in health finance look like in 5 years? Well, I think it should look like youth being in every space, every room, and every table, contributing their experiences and realities as trusted partners. And they are not just relegated to quote and unquote volunteers, interns, and youth delegates, or any other sugar-coating phrase, right? Because some of these terms now, sometimes organizations do tend to take advantage of them and not necessarily engage young people meaningfully when the important conversations are going to be hard. They're not on the table. They are probably in the rooms having coffee, right? So that's not meaningful youth engagement. And it should be noted that honestly the young people know exactly what they are doing, and they have the experiences, the the innovation and creativity to be able to contribute to the quest for better health financing. And I believe on that vision, if we are able to integrate young people into the healthcare system in general, what we start to get is innovative financing models, because the young people, especially the Nigerian young people, are very, very creative. Wherever you go, you get to see this. Also, better budgeting, strong accountability, and some satisfactory level of transparency, all in a quest for a better health outcome in the country. So I think this is the vision if young people are meaningfully engaged in health financing and health system at large. Thank you.
Thank you very much. Please, can we give a round of applause to our experienced panelists? This was a quite insightful session. I have gained a lot, and I hope everyone on this call has gained a lot as well. So we'll quickly move on to the question and answer session. Please, if you have questions, kindly raise up your hand so that we can identify you. We have very limited time on this, so we won't want to entertain much questions. But if you do have a question, please do raise up your hand so that we can be able to tackle that and then move on with the forum. Thank you very much. All right, we'll take Mr. Nasir, and then we'll take Modu Alhaji. So Mr. Nasir first, please. You can go ahead, sir.
Yeah, good evening, everyone. Thank you for the insightful discussion, and discussion is specifically to Yusuf.
Can anyone still hear Nasir?
Mr. Nasir, I think we lost him. We can't hear him at the moment.
Okay, we hope he's going to come back. We'll move on to Modu.
Yes, please, let's move on to the next. Mr. Modu. Oh, I don't know, his hand is not raised anymore.
Okay.
I don't know.
Thank you so much, because you already mentioned my name. That's why I lower my hand. Can you hear me?
Yes, sir, please go ahead.
Go ahead.
Okay, my question is my question is for Abdulaziz. One of the major issue around young people in around policy, health, and everything is nowadays, 3-4 years ago or 10 years ago, young people can be able to volunteer and do a lot of work around normalizing community to engage in the process of accountability, especially that has to do with health and other sectors. With the case study of Follow the Money, if we look at 10 years ago, Follow the Money has more community volunteers. But as a result of the economic situation of the country, inflation and everything, so the volunteering culture start fading away. What is the best way we can use to mobilize more young people to engage in the decision that has to do with their lives, especially how they can be able to track basic healthcare provision funds in their communities? Basic healthcare provision fund is something that even the government is now asking, where is this all money is going actually? How do we mobilize more young people in the era of fading volunteering culture? Thank you. Over.
So whenever I hear Maazu ask questions, I just feel a senior colleague also asking a question he already has a response to. He's quite experienced with community mobilization and youth volunteerism. But in recent times in our work, we've seen we just recruited volunteers across the 36 states of Nigeria for the Follow the Money. And in less than a month, with all the data and information we shared with some of them, some came back to say they don't think they want to continue because they do not have the resource. Knowing perfectly well that when the call came out, it was actually a volunteering opportunity. So when we saw this, what came to mind is simple. We have opportunities for fellowship. We have opportunity for people who want to take interns in different organizations. And the discussion has always been around how do you get your volunteers to intern with other organizations where they get their experiences, but they also get some little stipend for organizations that do not have the resource at the moment. Where you have them as fellows, attending fellowships or attending boot camps or accelerator programs. They have to work on some of the mandates of the organization while also delivering on some of the tasks that the accelerator or the fellowship has assigned them with and also has funded them for. These are some of the opportunities that arise in that area. However, beyond all of this, and this is a structural issue entirely in the civil society space, that a lot of civil society over the years have waited and dependent upon donor funding, and there should be that transition for major CSOs to begin to manage and maintain social ventures, which enables them generate revenue with which they continue to carry out this kind of good work. It's not a day's job. It's something they need to do because they've not been doing over the years. But this is the turning point that, if well leveraged, there's enough resource to be able to carry people along and be able to pay for some basic stipend. Mazu, I hope this responds to your question. And this could be a headway for civil society organization. Thank you.
Thank you very much.
Absolutely, answered my concern.
All right, perfect, beautiful. So I would like to ask if Mr. Nasir is still on the call so that he can ask his question, or we move on. Sorry, Dr. Ravikant, we might not be able to take your question because of time.
Yeah, hello. Very good evening, Dr. Ravikant here from India.
Please, we might not be able to take your question because of time. I apologize.
Except if the platform will shut us up, Ogani, I would suggest you could just let him take his question if for a
Am
very
I
brief.
audible?
All right. You can go ahead.
Dr. Ravikant, if you can hear us, you can go ahead with your question.
Yeah. Yeah, am I audible right now?
Yes.
Yeah, my question is that this is a very interesting forum about the regulation. This is a very important forum to impart this knowledge about the financing. So as I know that the adolescent are the demographic dividend of any economy. This is important. Financing is adolescent. It's very important, but I think no. The social determinants of health be different as per their economy, and it is very important to finance in other like education. In India, I think it's very challenging because there is a 2% of budget in health, and in other social determinants of health is very low. So I think the budgeting or the financing towards all these social determinants on health is very much important compared in the health. So I think this is very much important to understand and know about the financing in Nigeria on adolescents. So I think that was a very grateful opportunity for me.
Thank you very much, Doctor. I think that was a very wonderful submission and contribution at this point. It's well noted, and I believe we can further conversations around this area. Ogani, over to you, please.
Okay, thank you very much. I don't know if Mr. Nasir is back on the call to ask his question. If not, we'll just go ahead with other events in the forum. Okay.
Yeah, I'm here. Am I audible?
Yes, please go ahead, sir.
Yeah, thank you for giving me the opportunity again. I lost my network actually. Yeah, this question is for Yusuf. What do you think is the next major shift Africa needs to make in policy as regards to health and healthcare financing to become less dependent on external aid while accelerating progress towards the universal healthcare coverage? Thank you and over.
Mr. Yusuf, over to you.
Oh, yes, I was trying to mute my camera, my mic, and basically very important questions. And in Geneva at the World Health Assembly, many leaders actually met, convened by the president of Ghana, to say what they call Africa Reset, to say what is really the model that will work for Africa, particularly when we have become fully reliant on what we call external funding. And basically that's also a very big question to a lot of people who couldn't answer it well. And I think I will just try to give an idea of what I felt will be good and also what really will be better for us. I think the first key thing is actually increasing domestic resource mobilization. Someone said that. And basically, increasing resource mobilization, it's truly important because we have seen how risks averse we are not. Because basically today, as US government saying, oh, we are pulling some fund, we have seen how issues it have become. And basically, when you look at, for example, the expenditure for the whole Nigeria, I mean, subnational, national, and also external funding. External funding might really be not really much. For example, I can't remember the figures, but when you look around the trend, public financing is actually very big. When you look at what state government put at budget, what federal government put at budget, also what they take as loan. For example, World Bank, it's actually a loan. So when you put those together, you can actually see that we put a lot of money, but it doesn't translate to also releases. For example, last year we had the minister saying, oh, that 6 million was only released from the expenditure. When you look at that, basically what really has been running the funding was external financing because public financing is even much higher, but the releases are not there. So even while we increase domestic mobilization, we actually need to look at how we could compel government to actually come to what they have agreed upon. The second key thing I would like to say is around also domestic mobilization. We're actually what we call transition period between Nigerian government and also donor government. For example, when you look at the US government, they haven't pulled out, but they are saying in the next 5 years, we need to pull out. The Global Fund is actually doing what we call the GC8. So they normally do funding in 3 cycles. When you look at our malaria, TB, and also AIDS, it's been funded primarily by those guys. But they are saying that many countries may become unavailable to receive that funding. South Africa, this year, they notified them that they can't receive. Nigeria has received a notification that in the next 6 years, GC8 and GC9, there won't be any funding. So we're actually at a transition period. In the next 6 years, donor might actually go out. But what really could stand us along is actually to feel like, how do we ring fence our money? Ring fence in the sense that we have a lot of money that we can actually put, but sometimes I actually look at it. Is it an implementation gap? Is it an absorption gap? Is actually something. You look at, for example, basic healthcare provision fund. You see quarterly there's a release of 36 billion, 30 billion. But you can go back to, for example, primary healthcare and see there's money on the table. We actually were reviewing swap approach last week. When you look around, for example, transport management, it's not been absorbed. When you look around World Bank has 1.5 billion in health from the whole PLC to SWAB and other funding. But the state are not ready to absorb that because we have been used to, oh, we need training, we did this. But sometimes the only thing the government will say, oh, build facilities, put healthcare workers, I will fund the whole thing for the next 6 years. For example, primary healthcare has money that is telling state, who fund your healthcare personnel 100% this year. Next year, it will be 68.5%. In the third year, it will be 33.3%. From fourth year, you take 100%. But the government are not taking it. So we need to also put a heavy thing on domestic resource mobilization. And the other thing is that while we collect tax from people, the shortest way is actually to put them on insurance. People can't pay out of pocket expenditure. We also have debatable. I don't want this to bring this on this table, but there are also evidence that say, oh, for example, sin tax, what we call the sugar tax, the alcohol tax, tobacco tax are being removed, but they are not being invested in health. So those are key things we need to make a strong case for. How do you expand even the fiscal space to ensure that even we actually go with a better public financial management for domestic mobilization? I think that's the first key thing. The second key thing I say every day in every forum is that we will never do any good healthcare reform without investing in primary healthcare first. The whole reason why we're putting a lot of money in general hospital and in teaching hospital is not because money is not the problem, but the issue has actually been that we have neglected our primary healthcare. Primary healthcare that is supposed to be taking care of catarrh cough, that you can just put a chew, a nurse, a doctor, a physician can be there to do. But you are taking a consultant to be overstretched. I remember when I was trained in Usman Ofori jobs, you hardly go to, for example, to see GOPD. You go there to see pregnant women that doesn't have complication or someone coming with malaria. But when you go to general hospital and also, for example, all those tertiary hospitals, majority of people that fall there, it's actually those guys. So how do you also do that? A lot of money is actually going outside the healthcare setting. And on Friday, we had a meeting with private sector. We actually take, for example, almost 100 billion naira outside the country for issues that are even smaller. So how do you ensure that we actually put resources that will make sure that those money doesn't go out of the healthcare system? How do you also improve, for example, maternal and child health? We don't need to be start paying that, oh, we have Ebola. In the last few months, we saw that even the president has to approve, I think, 2 billion to say, oh, we need to put money on epidemic preparedness. So how do you ensure that if you already have a system, for example, primary healthcare that can do surveillance, why are you putting constrained resources to see that 2 billion will pay premium for health insurance for many people? The third thing, the shortest way is actually how do you do even health insurance expand that? And when you look at the trend, many countries that have achieved UHC have actually do correct healthcare reform. They have actually expanded their health insurance. As at today, apart from civil servants who are formal sector and some few private sector, no one pay insurance. The last count we saw was that Nigeria is actually now at 23 million, which is actually at 10%. If you take our population at 230 million people. So that's really small. We are talking about Ghana, Rwanda, and even more people that don't have good healthcare system. Trying to talk about 95%, 99%. So the shortest way is actually to have a supply side that balance with demand side. If your hospitals are really overstretched, when there will be a time that when you have a 99% insurance, you don't need to put anything as a governor for primary healthcare. I will pay you capitation, pay for output for every patient. If it is at 5,000, I will actually make sure that for every care, we won't even start talking about money on capitation. We'll start talking about performance system. Your primary healthcare has delivered 200 patients and there's zero mortality. So in the next year, I'm going to put some money there. So those are how some healthcare settings have worked. We have seen that even when we look at Nigeria, on percentage, we haven't improved our insurance. In the past 10 years, we are talking about 19, I think almost 15 million, and they are driven by state. That time, our population wasn't up to 200. So we can talk about 10%. We have improved the population, but we are trying to see that we improve, but the percentage increase. So you need to also improve on your poor rates. And there's also one key thing is that I would love to also bring about is actually around unlocking the healthcare value chain. In the healthcare reform, I know many people have seen what we call PVAC, Presidential Health Unlocking the Value Chain. So their job is actually to see those money that we take to foreign lands. There was a time that I think, apart from when EMZO started producing API last year, I'm not sure, but Nigeria doesn't have any company producing API. Those are binders for many who went to pharmacy school, know those starch those maize that we have. Those are key things we send our dollars for reserve to buy them. So how do you ensure that even when a pandemic, when COVID came, even the masks, I could remember I was in a hospital, even masks we have to buy. So how do you ensure that we don't do that again? So those are conversations that I felt even we start doing the reform. We need to start talking about the service delivery part, the demand side, the supply side, and also looking at even the value chain, the whole value chain. Is it a procurement system? I know many donors come to Nigeria to say, oh, we are going to use for example, our foreign procurement system. There's one door, there's something you feel like if, for example, a donor is putting 1,000 naira, you can see 700 going to commodities. But we can buy them here. They could have been cheaper, they could have been efficient, but we need to start buying. Then the government start paying for supply chain to move pool. So those are key things: supply chain management, workforce planning, digital financial management, and other things. I felt they are important as much as we are talking. So we talk about financial reform. We need to bring all this into the fora and also ensure that we actually have a very resilient system. So over, and I hope I actually answered your question.
Yeah, absolutely. I quite agree with you. Thank you so much, Mr. Yusuf.
Thank you very much. I think we can give a round of applause to our panelists. This has been a very insightful session, very informative as well. I hope we can be able to take the action points from every comment made by the panelists and be able to work on that. We'll be moving on to the second panel session, and I would like to briefly introduce our panelists, and then we'll move on to the questions. So as a way of introduction, Nigeria has made notable commitments to achieving universal health coverage, yet the gap between policy ambition and actual health outcomes remains wide for millions of our citizens. Progress in health financial reforms, from the Basic Healthcare Provision Fund to state health insurance schemes and broader financial management improvements, has been uneven. And while we have seen pockets of innovation and increased domestic investments, there are still challenges in budget execution, in accountability, in resource allocation, and in system efficiency. And so in the next 45 minutes, we would be assessing Nigeria's current progress in implementing health financial reforms. We would examine the practical implementation challenges across the health financing cycle. We'll also explore the critical role of public financial management and budget accountability in improving service delivery. And we're going to identify priority policy and financing reforms needed to accelerate our journey towards universal health coverage. We're privileged to be joined by a strong panel of experts who bring both national insights and global perspective. In a minute, I'll introduce them and read their bio very quickly. So the first panelist is Mr. Ademuyiwa Damilola. So Mr. Ademuyiwa Bamidele Damilola is an award-winning health financing, public financial management, and health systems strengthening specialist with over a decade of experience in advancing health policy, financing, and government reforms in Nigeria. He currently serves as the Director of Programs of the Legislative Initiative for Sustainable Development, where he leads donor-funded initiatives on health financing, epidemic preparedness, primary healthcare, non-communicable diseases, and accountability. He has supported governments, legislatures, civil society organizations, and development partners on budget advocacy, domestic resource mobilization, and health system strengthening. He was recognized by the Campaign for Tobacco-Free Kids and Global Health Advocacy, United States America, and has received the Global Health Advocacy Changemaker Award in recognition of his contributions to advancing health financing and policy advocacy in Nigeria. The next panelist is Mr. Oyeleke Dari. Is a Strengthening Health Systems Program Officer at Budget Foundation, where he leads health financial analysis, subnational budget advocacy, and primary healthcare accountability work across Nigerian states. With over a decade of professional experience spanning public finance and program management, he brings a rare combination of fiscal discipline and development sector expertise to his work. He holds a Bachelor of Science in Economics from Obafemi Awolowo University and a Master of Science in Economics from University of Lagos. He is a co-author of the 2026 Health Financing Report and the 5,099 Primary Healthcare Facilities Report, and has led state-level PhD engagement in Kaduna and other Nigerian states. While we await our third panelist, I would like to introduce Dr. Anthony Adoge, who is the Deputy Director for the Federal Ministry of Health, Abuja, Federal Capital Territory, Nigeria. He currently heads the division responsible for monitoring and evaluation of the health sector. As a lead data manager, he oversees and coordinates all routine and periodic arms of the National Health Information System, which includes all data platforms as well as health surveys and assessments. He's an ardent and passionate advocate for health innovation, standards, digital health, value for money. He holds a master's degree in international health from the Royal Tropical Institute, Amsterdam, and various certificates in healthcare management from various universities, including the University of Ryukyu, Japan, Nosal Institute for Global Health, University of Melbourne, Charity University Berlin, Queen Margaret University Edinburgh, University of Heidelberg, Germany, amongst others. So with a round of applause and our excitement and our emojis, let's welcome our panelists. You're all welcome, sirs. We welcome you this evening. Please, I would like to quickly confirm if Mr. Oyeleke Dari is on the call. Mr. Dari, please, are you with us this evening?
Yes, I am on the call.
Thank you very much and welcome. I'd also like to confirm if Mr. Damilola is also on the call.
Yes, thank you. I'm on the call. Great to be here this evening.
Thank you very much, sir. You're welcome. I would like to also confirm if Dr. Adoge is on the call this evening. All right. While we await Dr. Adoge, I think we would start with our panelists. Once again, you're welcome to the second panel session. And the theme for this session is policy, financing, and systems reform. And I already talked about our objectives for this session. Without further ado, we'll be moving into the questions. So to all panelists, in 1 minute, how would you describe the current state of health financing reform in Nigeria? In 1 minute, how would you describe the current state of health financing reform in Nigeria? I'll start with Mr. Damilola. You have the floor, sir.
Thank you very much. Let me first start by saying congratulations for this, for organizing this very important event and the platform that EquiCare coordinates. It's so good to be here and to be leading conversations on policy, financing, and systems reform in the health sector. So for me, I would describe Nigeria's health financing reform journey as one of meaningful policy progress. We've had in the previous session, we have very fantastic policies, very fantastic legislations. Our budget process is well structured. The budget goes through a whole lot of processes and all of that. But what we have currently is uneven implementation. So meaningful policy progress, but uneven implementation of such policies. Over the last few years, we have seen very, very important reforms. We've talked about the Basic Healthcare Provision Fund. Almost all the speakers have made reference to that innovative financing method, and it has become increasingly operational across all the states. Most states now have functional state health insurance agencies as well. The National Health Insurance Authority Act was also expanded and has given opportunities for financial protection for more vulnerable people in the country. And there is increasing recognition by governments across all levels that sustainable domestic financing is essential for universal health coverage. However, the real question, right, is not whether reforms exist or not. I think it is whether they are changing people's experiences when we walk into health facilities like primary healthcare facilities. And I think one of the former speakers in the previous session made mention of this. Today, too many Nigerians still pay out of pocket for essential healthcare, which ought not to be so. Budget releases remain inconsistent. This is an experience not only at the national level, but also at the subnational level, not only in the health sector, but across all the sectors of the country. And even where funds are released, budget execution is often very, very weak. I'll say, for instance, 2025 budget implementation for the ministry responsible for health at the moment stands at less than 2%. There are other issues like procurement delays, persistent and accountability mechanisms that remain fragmented. So to wrap up, I would say we have made some progress in policy design, fantastic documents everywhere, especially we did of our meeting today. Budgetary allocation and health financing for health, that we are talking about, but we now need equal ambition in terms of implementation, accountability, and performance. So the next phase of reform should not simply be creating more policies. It should be about ensuring existing commitments actually deliver better health outcomes. This is how I would describe the current state of health financing reform in Nigeria. Thank you, and over to you.
Thank you very much, Mr. Damilola. I would like to hand over to Mr. Jare.
Okay, I think Mr. Damilola has rightly wrapped the reform progress over the years very succinctly. We have seen a lot of policies being made over and over again over the years, the BHCPF, the National Primary Healthcare Policy, and so many of these policies have been made over, but we've had one shortfall over the years, and that is implementation, as he has rightly said. We've had issues with implementing these budgets. The health minister was saying over early this year about the amount of funds that have been released for the primary health care in Nigeria for the 2025 budget. So we have not had issues with policy creation. The only issue we have been having is the implementation of those policies, and that's a big minus to what the government is doing. I believe going forward, we should be looking at bringing the implementation of these beautiful policies that have been created to bear. So that's where I will wrap it.
Thank you very much, Mr. Jare. So over to Mr. Damilola. You have worked extensively on public financing management and legislative accountability. At which stage of the health financing cycle do reforms most commonly fail? And what practical reforms are needed to strengthen implementation? You can have the floor, sir.
Yes, thank you so much for that very, very important and interesting question. And I would say it is important because health financing is not just about raising money, right? It's about ensuring that those monies or those resources actually produce better health services. That should be our focal thoughts when we are thinking about health financing. So, and this is what health financing experts usually refer to as delivering more health for the money. You're able to deliver more results for the little available resources that you're able to mobilize. And this is very important because, for instance, in Nigeria, there has been a whole lot of economic issues. Budget is not being implemented. and several other challenges that continues to impact on the health financing system of the country. But then even the little resources we have that we've been able to pull, what exactly have we done with it? That's the question. So from my experience, working with several stakeholders, including government institutions like the legislature, the executive arm of government, even feedback from civil society organizations, development partners, reforms most frequently fail, right, during budget execution and accountability. And I think during my first response, and my colleague also alluded to that our budget process, putting all those things together are fantastic, but execution and implementation is the problem. I would like to include another level to that, which is accountability or monitoring systems. That has continuously failed over the years. So Nigeria generally, we do not struggle to produce our annual budget and related policy documents. What we've only struggled to translate those commitments into timely releases, efficient spending, and measurable service delivery, which are critical if you are going to do anything within the health system. So I would usually describe the health financing cycle in 5 stages. This is also similar in all the other sectors as well. The first stage is policy and planning. And we've talked about policy since the beginning of this meeting today. And this is where policy materials, action plans, guidelines, whose implementation usually span years, are developed. Very good examples are the National Action Plan for Health Security, that's the NAMS. We have Multi-Sectoral Action Plan for Non-Communicable Diseases, MSAF. There are several other policy documents like that in the health sector alone. So these are very fantastic policy documents, but with evidence-based suggested actions, and of course with their projected costs across all the sectors. But this kind of materials, or let me say this kind of materials also influence the development of annual operational plans. That's the first stage. The second phase for health financing cycle is the budget formulation. This is where MDA synthesize activities from their costed plans, particularly their annual operational plans, into the next annual budget. For instance, currently MDAs are planning for their AOPs, right? Developing their costed annual operational plan right now for 2027. And these are compiled by the ministry responsible for budgeting and planning. So all the MDAs submit their budgets based on their AOPs to the ministry responsible for budget and planning, who compiles everything and sends it to the Federal Executive Council for review and approval. It is the approved version that the president presents to the National Assembly. I'm sure all of us are aware of that. The next stage is budget approval, and this is where the National Assembly scrutinize what the president presents to them. The National Assembly usually leverages state using their statutory functions to either include or remove projects that they feel will benefit their individual communities and constituents better. This is what we call padding. Whether this benefits the country or not is not a focus for the discussion for today. I know many of us will have questions around padding, but that's not what we are here to discuss. I really also want to emphasize that though there are issues around that system, but it has also been beneficial. For instance, the BACPF we've been talking about all day, we are seeing its implementation because the National Assembly actually padded the 2018 budget to include the kickoff fund for BACPF. So, and this was because, after 4 years since the National Health Act was established by law, the fund which was passed with that law was not implemented. So they leveraged this power of theirs to include the BACPF in the 2018 budget. I'm just trying to put down this background so that we understand how the budget process works. After scrutiny, NAS passed the budget, they send it back to the president for another round of review. And if this sits very well with everyone, he appends his signature and it becomes a law. The fourth stage, which is one of the most critical, is the budget execution phase. And this is where Nigeria, across all sectors, across all levels, have continuously failed. They have not, come to par. So MDAs based on several PFM rules and processes request access for the allocations from the approved budget or from the appropriation law. And this is where we hear terms like releases, cash backing, execution, utilization, and all of that. And then the last stage, which is also equally critical, is monitoring, evaluation, and accountability. And this must include legislative oversight of all the projects that are suggested in the budget, and also give reports of their status of funding utilization across the fiscal year. So unfortunately, or let me say ironically, like I said initially, the first three stages often receive the greatest attention, while the last two determine whether citizens actually benefit from the budget. I want that to sink in. It is the last two that ensures that the citizen actually have access to the services, the budget items in the budget were actually put there to achieve. For instance, let's assume the legislature approve funding for maybe primary health care. But if the releases are delayed, if procurement processes are inefficient, if facilities lack the spending autonomy to do the work they ought to do with the fund, or performance data is unavailable, then communities will never experience the intended benefit as we are experiencing it right now. So this is why public financial management reforms are so critical, especially at this time with all the experience that we've had over the years. So for me, I believe there are 5 practical reforms Nigeria should prioritize, considering all we have seen played out in the health sector as far as public financial management is concerned. The first one is that we must improve budget credibility. We must improve budget credibility by ensuring that approved health budgets are released predictably and on time. This is very important. Secondly, we must strengthen expenditure tracking from the federal level down to the states, down to the local governments, and also individual health facility, so that every naira can be followed. I love the work code has been doing over the years to ensure that there's accountability in the system and every naira budgeted for is accounted for. Great work with budget and also code for that support that they've rendered so far. Thirdly, we must institutionalize routine legislative oversight. Apart from the blind MDAs checking through what implementation looks like for them, there has to be that legislative oversight as well that focuses not only on budget approval, but also on the implementation and service delivery outcomes of the budget. The CSOs also have roles to play. That's what budget, code, and other CSOs like Listel have been doing to ensure like an external and independent review of status of implementation of the budget. Fourthly, improving transparency by making budget execution data publicly available in format that citizens, researchers, and civil society organizations can understand and use. This is extremely important. My good friend Uzeni from Code mentioned the other time that funding information from the budget are not transparent, and I will also align with these thoughts because this is a huge problem that continues to weaken accountability and efficiency of the use of resources we have for health reforms and health programs in the country. We have budget documents published online and accessible. We have all the budget lines disaggregated by agency, even down to budget lines. But when it comes to budget execution data, they are extremely difficult to come by. And even when you have access to them, they are not well disaggregated. So you can't get a true sense of what exactly is going on with budget implementation with the information we have published by the government. Finally, we need to strengthen citizen accountability. I made mention of CSOs doing fantastic work the other time, and we can do this by creating structured mechanisms for communities, for young people, to participate in monitoring health investments and providing feedbacks, important feedbacks to government for lesson and and learnings. So for us, or for me, we have learned that accountability is most effective when governments, the legislators, civil society, communities, development partners, all of us, we all work together, including youths, all of us that we are on the platform, we all work together to ensure that what we have proposed to do through our budgets, through the resources available for us, we are able to implement them. Accountability should not be viewed as criticism. I like that Uzeni also mentioned the other time. Because most government stakeholders or ministries see it as if people are auditing them, CSOs are auditing them. It shouldn't be so. It is accountability is actually an essential tool for improving performance and also building public trust. So success should not be measured by how much money enters the health sector. That's just the bottom line, how much we have been able to appropriate for. Success should be measured by whether more women are safely delivered in health facilities, whether children receive essential services, whether families are protected from catastrophic health expenditure, and whether every public naira invested produces better health outcomes. I would like to stop here while I hand it over to moderator. Thank you very much.
Thank you very much, Mr. Damilola. I would like to move on to Mr. Dari. So, budget has transformed how citizens engage with public budgets. How can technology improve transparency in health financing and enable citizens to track whether public funds reach frontline health facilities? And also, can you share an example where data transparency directly influenced government action or improved accountability? Over to you, Mr. Dari.
Oh, thank you, moderator. I want to really start from where Mr. Damilola stopped, talking about more money for health and more health for the money that is being allocated. It's very important because in Nigeria we have more bogus budgets every year. We have this year alone we have something around 2.51 trillion naira being allocated to health in 2026 health budget. But at the end of the day, how much is being released? That's what matters, because and then the released fund, how are they being tracked? Now, coming to the question that you asked about how tech can really help the health financing transparency in Nigeria. Now, the first thing is that technology, civic tech, helps to visualize and simplify the budget. Many people, Nigerians generally, and all over the world, when the budget is being made, it looks like a pile, just lot of things being gathered together, and people cannot really pick up the information that they need. But with civic technology, we are able to simplify and then visualize the budget so that it's accessible to everybody. You know how much is going to this to the primary healthcare. You know how much the government is spending on secondary health facilities and to other parts of the health sector, maybe the insurance sector and other sectors of health. So it helps, technology helps to visualize and then simplify information for the populace. And number two, it helps to track execution. There is real-time tracking when we bring technology, civic tech, and that's what budget does. Budget helps to know how much is being released per time, how much is government releasing for BHCPF and other allocations in the health sector. How much, if we don't have technology, we might not be able to track all those things that governments say they do. Most of the time, when they say they have released a particular fund, you can actually go to those facilities and ask if they have been brought up through technology. You can easily ask and visualize the facility if what government actually said they had spent on it has actually been spent on it. The third thing that technology helps us to do is it also helps us to get the facility, and that's what one of the things that budget does. PAT facility tracking. We can actually track the scorecard, we can know how if the personnels are there, if the equipment in the PATs are actually functional, if the security status of the facilities are okay, and if there are referral systems, the ambulance, are they available in each facility. We can actually track what is going on in each of the PATs. We currently do that at budget, and under our PAT tracker program, we have a website that monitors it nationwide. It monitors primary health cares, the facilities. Do we have the presence of health workers in each of those facilities? Do we have drugs available? Do we have functionalities of equipment? How many hours do these facilities do even operate? And the referral systems too. So we are able to track all this through technology. And finally, we are also able to track citizens' feedback. What are the citizens saying? What do they report concerning the facilities and even the human resource people who work at the facilities? What are they saying concerning drugs? Are they available in all the facilities? We can actually track. In budget, like I said earlier, we have a web PAT tracker that tracks citizens and patient feedbacks. We are able to do that all through technology. So we can easily get reports, we can easily get feedbacks from citizens and even patients through technology. So I'll put it at that. Let me add one more thing. We can also track health insurance. Health insurance. I was listening to earlier speakers who spoke about the percentage of coverage that we have in health insurance in Nigeria, just below 10% at the moment. So all these things can be tracked through civic tech. Thank you.
Thank you very much, Mr. Dari. So we'll be moving on to the next question, and this for both the panelists. In 1 minute, if Nigeria could implement only one health financing reform before Youth Health Financing Forum 2027, what should it be and why? In 1 minute, if Nigeria could implement only one health financing reform before YHFF 2027, what should it be and why? Mr. Dari, you have the floor.
The reform I will seek for is the expansion of the BHCPF fund, BHCPF funds from 1% to 2%. I know the Senate it has passed the first reading in the Senate. It needs to pass the second reading, and I want to plead. I'm using this medium to plead with the National Assembly at large to help pass that reform so that we have an increased funding to BHCPF from 1% to 2%. Thank you.
Thank you very much, Mr. Dari. Mr. Damilola.
Yes, thank you very, very much. Well, I'm so sorry. I would like to suggest two, if you permit me. I will not stay on one. So if Nigeria could implement, say, only two health financing reforms before we meet again next year, my first choice would be to institutionalize performance-based public health financial management and accountability across the health sector. And of course, the second would be that we mobilize other sources of innovative domestic public financing. Why did I say this? Firstly, we already have many of the right policies. We have very good budget. We have good budget processes. We may have issues with what is being included in the budget because of oversight. But I believe that if we are able to improve the system and ensure that these policies we have in place, including the budgets, they are well implemented, there will be a real change. We need to move beyond measuring success by how much money is budgeted, you know. Instead, we should ask questions like, were these funds released on time? Those are important questions we need to ask. Were those funds spent for their intended purpose? Did they improve service delivery? Did they reduce out-of-pocket expenditure? Did they improve our health outcomes? You know, those are more cogent questions we need to ask instead of focusing on how much money was budgeted. I would want to advocate for a national performance and accountability framework, right? Where at every level of government, from the Federal Ministry of Health to the states, the local government, and even health facilities, they are able to track not just financial inputs, but measurable results. And this should be supported by transparent and full reporting of budgets, releases, and expenditure, just like my colleague had said, using digital platforms and every other means that we need to put in place to track. Then this also should be supported by routine performance reviews. We need to publish reports of our budget performance routinely. We need access to all this information. There should also be legislative oversight that are linked to implementation outcomes. And of course, also important is citizen feedback mechanisms established. For me, I believe that when performance becomes visible and accountability processes from the government side becomes routine, efficiency improves, you know, public trust grows, resources are more likely to achieve their intended impact. And this is when we can do much more with the little available resources that we have. I believe we already have enough to push the needle and change the narratives of the current status of our health outcomes. And of course, the observable suboptimal results in our indicators that are measured over the years. Secondly, we have seen the magic that BACPF has contributed to Nigeria's health financing architecture. There are several lessons that we need to put back into the system. So we need to start asking ourselves at this point, can we mobilize other forms of innovative financing like this? Because I strongly believe that this will help to fill the gaps that we are still seeing with budget implementation while we address that crippling situation. And a good example of what we can do differently is the sin taxes, you know, and ring-fencing a portion of those revenue for health. And just like Dari said, the National Assembly has taken a very, very bold step to catalyze this process. But just to provide further updates from to what he said. So in the Senate, it has actually been passed. It has gone through all the legislation process in the Senate. So right now from the Senate, what we have is that BACPF has been increased from 1% to 2% of the consolidated revenue fund of the country. But it still beckons on the House of Representatives to also pick up the process and ensure that they pass this important legislation so that it sees the light of day before this assembly winds down. Because once this assembly winds down, that all the effort put in the process will go to waste. Another important area that we can also look at is the National Assembly rather has also been able to catalyze progress is the excise duties on SSB, that's sugar sweetened beverages, to remove the flat rate of 10 naira per liter and introduce a portion, say percentage. I think stakeholders are pushing for 30% of sugar sweetened beverages, around 30%, and then ring-fencing a portion of that revenue to fund important health programs. I believe that this will make resources readily available, predictable, and sustainable to strengthen Nigeria's health systems. So I would like to see the National Assembly finalize these very important legislative processes, and also the President assent the two bills into law for implementation as soon as possible. Thank you. I would like to throw it back to you now. Over.
Thank you very much, Mr. Danola. We spent quite some time on on this. This has been a very insightful session as well. I would like to ask if we have questions. We'll just take 2 questions and then we'll move on. So if you please have questions, you could please raise your hand up. Just 2 questions and then we'll move on. All right, it seems we do not have any questions. Once again, please let's use our emojis to appreciate our panelists. We've had such informative sessions, very, very informative sessions with a lot of call to actions, a lot of action points for us youths to be more proactive in health financing and health financing reforms. We will quickly move on to the next agenda, which we'll be hearing from our partners. We'll be hearing from Connected Development and IDP. I'd like to start with the presenter from Connected Development Code. You have the floor, please. All right, we'll move on to the second presentation from our other partner, which is International Budget Partnership Nigeria. And I'll briefly read the citation for the presenter, who is Ms. Chika Oko. Chika Oko is a senior program coordinator in the International Budget Partnership Nigeria, where she leads the country office Task Equity Initiative and the Strengthening Partnerships for Accountability, Results and Knowledge, SPARK program. She brings extensive experience in governance, accountability, and development programming, with a strong track record of supporting multi-stakeholder partnerships across Nigeria. She has worked on major FCDO-supported governance programs in Nigeria, including the State Accountability and Voice Initiative and the Partnership to Engage, Reform and Learn, contributing to reforms in tax, budgeting, gender, disability inclusion, health, education, agriculture, media engagement, and local government. With our round of applause, please let's welcome Chika Oko. Ma, you have the floor.
Good evening, everyone. Please, can you confirm if you can hear me well?
Yes, we can hear you.
Okay, great. Thank you very much, Epicare Strategies and all the panelists, everyone who have spoken so far. We appreciate you for all your contributions. So I work with International Budget Partnership, and I would like to briefly share with us what we do in IBP. While I was listening to all the presenters, it almost sounded like they also work in IBP, because what they have all been talking about are mostly the things that we do in IBP. So I'm going to keep it brief and short. Okay, so IBP stands for International Budget Partnership. We are in an international non-governmental organization with headquarters in Washington, D.C., but we also have our office in Nigeria. In IBP, we say that we want to see public money work for everyone. So our focus really is on the budget. We believe that the budget is an expression of societal values. So when you look at the budget and you see where priorities go to, that shows what our society actually values. So it is a very, very important instrument we already know, which everyone should pay attention to. IBP focuses on how governments raise and spend money, and our focus is on ensuring that that is done in an equitable manner. We also want everyone to have voice in how these decisions are made. IBP has been operating for 25 years now, globally, but in Nigeria, we started around 2018 and we've been here for around 7 years. IBP believes a lot in partnership, and so we work with civil society organizations, community groups. We work with networks, we work with government actors, champions, budget analysts, researchers, different groups, media, name them. So we work with various stakeholders to get this work done. We don't work alone. Okay, so in Nigeria, since we are looking at how government raise money and spend this money, we have programs that are also designed, tailored to respond to these issues. So we have programs around tax equity that looks at how government raise revenue and if those processes are equitable, is everyone paying what they are supposed to pay, and do we have enough money raised? You know, so tax equity generally strengthens taxation, you know, how government raises revenue within the country. This program is also being implemented not just in Nigeria, but in other countries in Africa. We have the Strengthening Public Accountability for Results and Knowledge called SPARK. SPARK is a program that is looking at the service delivery end of budget. Okay, so it is not just about raising money. How is government spending that money? So SPARK focuses on service delivery that is equitable, targeting marginalized communities, vulnerable communities, ensuring that services get to them and they get to participate in these processes as they should. So our focus in SPARK includes health, as well as agriculture. And so we work with groups like Smallholder Women Farmers Organization of Nigeria, and that is for the agricultural part of the SPARK work. While we work with groups like Justice and Development Peace Commission in various states, Community Empowerment Network, World Development Committees at that very basic level, okay, to be able to track what is going on within their communities. So they focus on PHCs, they focus on ensuring community engagement in health financing processes. Then we have the budget credibility. I'm happy that I've heard people talk about that. So it is not really about raising money, but it is about the process of raising that money, approving the money, you know, and spending that money to realize the set objectives of service delivery. And we have come to find out that service delivery often break down along these lines. Money is approved, but you know, it is eventually not allocated, or if it is allocated, it is not released. If it's released, it's not cash back. If it's cash back, it's not utilized. So somewhere along that line, the chain breaks. So that is what that's what budget credibility is looking at. So we have programs around that, and we have one currently going on in Kano State that is looking at PHC budget credibility. So that tracks how government releases money and how that money gets to the PHC at the end of the day. But we are focusing mostly on where this breaks down within government. And so we have designed tools and processes that help government to work together. health, budget, to be able to sit down and say, okay, where are we having these gaps? Where are the bottlenecks? And how do we track this? So we've provided them with tools to do that and the platform to be able to do that. We also have our open budget survey, the OBS, which is conducted biannually, once in 2 years. And that goes on in about 125 countries. The recent OBS report was just released like about a few months ago, and it's being launched across the world in different regions. So we can go onto IBP website and see what the OBS says about Nigeria. We have very dismal report for Nigeria for this current assessment, and that says quite a lot, and it's something that young people can actually look into. Why do we have very poor results in participation and in oversight and in other areas, openness, that the OBS is measuring? We also have projects around debt accountability, and that is another gray area, when you're looking at health financing. Why is government borrowing so much? And how are they involving Nigerians in that borrowing decisions? What are the impact? Are they delivering the services they were borrowed to deliver? So that is what our debt accountability work is looking at. We do this in our work in different ways, but I'll just mention a few. Like, we look at systems change. We focus on systems change. We want to address, it's like a pipe. When there is a break in the pipe that delivers water to your house, you will not get water. So how do we track that and be able to identify where that break has happened, so that we're able to address that system challenge or system gap? Another important thing we do is what we call strategic accompaniment, which is a kind of capacity building that we provide to the people that we work with, movements, civil society groups, different organizations. So what we do is to really support them on a day-to-day basis, like a form of hand-holding, helping them daily to be able to know what to do and to deliver on those things. We also support coalitions, networking, and learning. Learning is very important for us. Okay, so we work in different locations across the country, in different states, at national level, and in almost all the regions in the country under different programs. Yeah, we have seen a good number of results coming from what we are doing. For instance, when budget performance is at 10 or 15% or 20%, you'll be shocked that certain amount of money is allocated. But at the end of the day, they're able to only utilize about 20% of that money at the end of the day. That means 80% never got to the end where it's supposed to be utilized. So we have seen this change in states where we work. We have seen communities get involved. We have seen like women farmers, become members of budget committee in their various states, in their locations, contributing to what is going on in the budget, adding their needs there and getting more access to inputs, to equipment, and so on and so forth. Basically having voice in decision making. We have seen women groups in businesses being able to speak up, ask questions about tax. They are not running away again because they have gotten more information than they ever had to be able to engage the process. And through that process, issue of tax equity has improved in their business, and they're able to interact with tax officials. We have seen these changes in primary health care with increased health workers, health personnel being employed. We have seen BHCPF funding in locations where they were not getting it. For instance, in Niger State, we saw in Niger State where PHCs that have never gotten basic healthcare provision funds started getting it, paying their own counterpart funding as well. So we see a whole lot of changes. I will like to quickly jump to, because I'm given 10 minutes and I would like to keep to that 10 minutes. I would just like to say a few things about how young people can be part of this process. What can you do? One thing that we fail to realize is that nobody is coming to save us. We have to save ourselves. There's nobody coming to our rescue. If our country is going to be good, we are the ones that will make it good. And if it's going to be bad, we only have to do something or not do something. That is to say, fold our hands and watch things go wrong. So what can we do as young people? One major thing we can do is to start from our community. Start from your community, wherever you are. If you can't find any group that is already engaging, bring yourself together, form a community within yourself, your own group, and begin to engage. Get your budget, begin to ask questions. What is allocated, maybe for primary health care center within your location, for any health facility in your location? Ask questions. What is being provided? What are we seeing on ground? You have tools, for instance, like the budget tracker and so on and so forth, that can be utilized. A whole lot of organizations like IBP too, we have community actors there that are engaging. Find one of these community actors and be part of the process. Join them, start asking questions, engage, track this budget, this project within your community. Just pick up the budget and ask questions. Participate in budget cycle at your local government, at your state level. Ask your local government representatives questions, okay? What can you do as a young person in all of these things? The issue is that when people keep quiet, the policymakers feel more relaxed. Nobody's asking them questions. Nobody's checking anything. So, but you can rise up and begin to do this within your community. Also, one of the advantages that young people have these days is tech, AI. What can you use technology to do? That it must not be a very complex or too advanced something, but something that can help you, to keep track of what is going on in your community. So you need to organize, you need evidence. It's not just getting angry about everything, but just like I've been said by other, the panelists and all of that, you need evidence to engage. You need to bring yourself together. You need to be persistent. Don't just engage in once, get disappointed, and then you just end it. So if you start from your community, that is one way that you can, make a huge difference. You don't need to go and start at the national, international level or whatever. Those are very good, but start the change from your community. So thank you very much, everyone, for listening to me. Let me end it here because we are given such a short time. Thank you.
Thank you very much, Ms. Chika. Please can we use our emojis to give a round of applause? We appreciate you and your time, and we thank you for the support that is your partnership or the partnership between IBP and Equity Strategies brought so much color to the YHFF. Thank you very much once more. Right now, before we move on to the last aspect of the forum, I'd like to hear from us, the participants. What are the things that we have gained? What are the action points that we have received from the 2 days, not just today, but even yesterday, even the pre-conference workshop? What are the take-homes that we have received from these events? Please, you can raise up your hands. We'll take a couple of persons that would like to speak. What have you learned? What are the action points you have gained over the course of the forum? Anyone who would like to speak, please just raise up your hand so you can speak. Okay. Please, sir, go ahead. Hi, Chief Akomola Pius.
Thank you very much. And it's been so interesting and very enriching. Let me take it from yesterday. When I think Dr. Ifeanyi had made this presentation, he challenged us with the early part of the WHO quotations. And after which he was able to raise that, okay, there's this 15% Abuja declaration for the health sector. Now that local governments are autonomous, there are federal allocations directly to the local governments. I think it's another good time. It's a good opportunity for us now to see how we can engage them, and the engagement will now be productive. As to this, do we really have a data on ground? For instance, we have for states, 15% Abuja Declaration. Do we have certain percentage which we can use as a tool to equally engage them? And if not, can budget support us with certain evidence-based data with which we can engage them? Still quoting from Ifeanyi, where he said about 80 to 90% of services should be provided at the local by PHC. If the local governments are not challenged to action, they will not wake up. And so what I would be interested in does that advocacy tool, that evidence-based data, which you can also, this is a declaration from this, or because you're autonomous now, you are mandated to do this. So if I can get some tools, data, evidences around that, I think I'll be okay. So far, so good. See, for the past 2 days, it has been enriching. And here, good enough, I'm a member of the State Oversight Committee on BACPF here. I've been able to get some things down to engage my members. And we are having a meeting. So this meeting is very timely. On Tuesday, I have so many questions to raise while at the meeting, because I see that in policy decision and policy making, I don't see certain percentage of youth involved in planning. I don't see youth involved in budgetary planning, not to talk of implementation. And so these are areas now to raise up. And if you look at the percentage of youth, they take about 60% of the whole population. And so why then are you budgeting for them rather than they budgeting and get involved? And without the involvement, there can be sustainability. And so the period, I mean, this period and the training has been so enriching, and it has equipped me to really engage more. But as to this, I think I will want some sort of support with the data I requested for. Thank you very much.
Thank you very much, sir. Your comments were well noted. I don't know if Mr. Dari is on the call at the moment to be able to respond concerning the data from budgets. I do not know. I think he has left the call. Okay, we'll just take this. Well, we'll see how to get him around to respond to that. Please, we'll just take comments from Christabel and then we'll move on to the last aspect of the forum. Christabel, please go ahead.
Okay, good evening, everyone. Thank you, Equity Care, for this wonderful forum that you've created for us. It has been very inspiring. This for me, I joined yesterday and today. I could not join the other, was it on Thursday? I could not join on Thursday. And I've learned a lot, and it has also challenged me to do more and also see how I can also support my community. And I just want to add that part of the project that I'm working on currently, it's on identifying issues and gaps around the enrollment on the basic healthcare provision fund in the rural community. And this platform has been very enriching for me. I've learned a lot. And then I also want to add that my organization, we are we are open to partnership and collaboration, because the project we are currently implementing is on policy advocacy on decentralization of the basic healthcare provision fund enrollment centers in the rural communities. So we just want to add that any organization that want to partner with us, we are open to that. And also I would like to invite some organizations that are working particularly in areas of health financing in our upcoming validation meeting. So I will drop my details in the comment box, and then that's my phone number and email address, so that you can reach out to me, and then we'll continue the discussion from there. And then we'll also be glad to have you in our validation meeting and also in our subsequent engagement on this policy advocacy engagement. So thank you very much, Equity Care and other presenters, for this past days that we've had on this session. Thank you. Over.
Again, I don't know if you called me. I'm not sure. All right, thank you very much. So before I start, I would just like to take the last person, Muhammad Mubarak. I think you raised your hand for a while. Just in 1 minute so that we can start.
Okay. Thank you so much. I'm Muhammad Mubarak from the Bauchi State Accountability Mechanism for MNCH. That's one of the slums state-led accountability mechanisms. And then for me, what stood out throughout this conference, I think it's about the discussions around it's not everything that we for us as youths that there are some doors that you can open them with creating rapport with the key stakeholders in your various states. For us here in Bauchi, I just want to share a little tip, and I think it might help others. And then, just like Christabel said, we are open to partnership with or any other state that are trying to establish their own slum. They can reach out, and then we can provide the support and guidance. So, when you establish relationship with these key government stakeholders, it's not everything that you go out showing that you are right. It's about building that relationship, building that rapport, and then sometimes you're still on your own, and then they'll give you a call that this is the problem on ground. Please, we need you to advocate to so person. So they will do every homework for you. You'll just be at the forefront. So let's try and maximize the relationship that we have, and then any available relationship, let's try and maximize it and use it well. So it's not all the time that you think about there's FOI, freedom of information, and the rest. Thank you, and over.
Thank you very much, Mr. Mohammed. Thank you very much to everyone who have spoken. I believe that this has really been an insightful forum for each and every one of us. So we'll be moving on to the last part of the forum, and I'll be handing over to the Executive Director of EquiCare Strategies in the person of Mr. Joshua Aluga, in which the launchings will begin. Thank you very much. Over to you, sir.
All right, thank you very much, Ogene, for the privilege, and thank everyone for listening. I know it has been a stretch for each and every one of us, so I'd like to not take so much time on this. So thank you everyone, and I also want to appreciate everyone for your commitment throughout this forum since the pre-events to this time. Most of you were actively participating, contributing, asking questions, and were actively involved in most of the discussions. And that's a privilege. That's something we want to see happening and consistently. Even after this program, we intend on seeing that. So first of all, I wanted to start with this background first before we get into our campaign report in general. So for this particular policy brief that we'll be launching, just the background about it was that the entire campaign started in 2025. We started planning for it around ending 2024. That was ending 2024. That was when the concept and everything started. So we had that in mind, planning it and everything. Then when we entered 2025, then we just had the greatest shock, like as if we were planning for the campaign. Maybe we have spoken to Trump or something like that, because based on what we've seen and all, wanted to start an advocacy on health financing in Nigeria. And we just got a shocker from Trump on external funding and all in most countries, Nigeria affected and all. So it's quite aligns with what we're already planning for. So, and from January to June, we're all making all the preparations, trying to plan how we intend on launching our program, working on this document that you are seeing. So this document, we've started working on it for almost a year and some months, right? So because most of the insight we got from it was what we used for the campaign and all. So I will just go over and just give you a summary. The document will be shared after this. So I just gave you the background of what exactly happened before we started the campaign itself. So what we observed, this one starting from budget allocation 2025, it was just 5.14%. Nigeria has been seeing Abuja Declaration and all. We've seen it consistently happening. People have been advocating for, okay, we need to increase funding, we need to do this, we need to do that. We also realize that apart from that, also the health sector is plagued with a lot of people are leaving the country and all. There are no doctors on ground, and the human resource is messed up and all. Please, can you mute the mic? So apart from that, also we also looked at the entire budget. That's from 2025. Look at 2024. Just look at how the budget has been so far. And please, can someone mute the person speaking? So we realize that there are different priorities. The country prioritizes a lot of things. One of the major priorities that we realize in Nigeria is security, right? So most of the funding goes to security. Most of the next is infrastructure. And security is very evident why most of the funding actually goes there in Nigeria. Infrastructure also goes, education, then like healthcare is like the fourth priority on the list. So basically the budget will literally be able to show you like what exactly is the priority of the country, what is the country prioritizing at and almost every year. And this has been how it has been for over a decade. Most of the time it's usually this. Healthcare hasn't gone like up. That's barely been, even this 5% is even like a success. Before, previously it has gone to 4 5 like that. So it has been going here and there. So those were some of the things we saw. Now, and it wasn't, but we later realized that okay, people have been saying we need budget more, okay, we need increased funding and all, but we realized that it wasn't about funding itself. It wasn't about increasing funding. Increasing funding, it's very, very important, but that's not the complete picture. And the government will say we have allocated this, but you later realize that this is not what is on the ground, right? Now in 2023, 448 billion allocated, and we only saw 27% was released, like completely. Only 27% was released that entire year. And the 27% that was released, only 70% was actually spent. So you will have seen how it has gone, like just keep on dripping. This one was 2025. That was just last year. This one, I think it was trending on the news and all. For capital, part of the capital expenditure budget, it was just like 0.016% that was just given. Now, this is some of the major issues that we realized that was one of the major problems that we're seeing around health financing at almost every level, both national, states, local level. That's like has been how that has been the picture everywhere. And another thing we realized is persistent delay. So if they said that okay, it has been agreed, we'll start and the budget has been approved and everything, and the funding won't be released maybe till close to the middle of the year, right? So that means all the plans that you have for that year, you won't be able to achieve. You have to like roll it over to next year and put it in the budget again for another. So it keeps on happening like that. So most of the money that's approved not utilized because it's not like the time that was given was not enough. So that was some of the issues that we saw. Now, and this has been the Nigerian budget that has been so far from 2021 to 2025, from 4%, from 5%. It has just been hovering around 4 to 5%. We haven't even come close to that. Now, when we compare it with regional and like how the regional priorities, we've seen Ghana is up there, Ethiopia, Rwanda, and Nigeria is still down there. And now this lack of funding at almost every level has one of the major impacts that we've seen is in primary healthcare. Basically, there's a lot of issues. Since there is no funding for primary healthcare at the local level, there's also not even funding. States is not still supporting primary healthcare facilities in most of their budgets. Even apart from that, so we're having all these inefficiencies in the, how will I say, in funding for healthcare. at the state level, not reaching them. Federal level, the same issue. We are talking about BHCPF and all, but still we are still having the same issues. States are not giving counterpart funding, and some of the funding is not even released on time. So most of these issues, primary healthcare are like majorly hit with all these issues that is happening at almost every level. So this only 20% of primary healthcare facilities are up to standard, less than 20%. So what is telling you that 80% of primary healthcare centers in Nigeria are not up to standard, right? Then greater than 60% diagnostic equipment are deficient in the country also. Now, and this has also affected the economy it's all, because if you are talking about healthcare contributes significantly to the economy and all. Realize a large number of households put into poverty, productivity cost affected, and this has caused a lot of destabilization across the country. Now, based on the issues we've seen, we're able to propose certain solutions. One of the major, we divided into different, how will I say now, based on when we want these things to happen. Immediately, what we're looking at transparency, basically. Most of this health expenditure have at all levels, federal, state, and local levels, so that we can have public oversight on how this funding is going. We're also looking at insurance enrollment increasing to 30% by 2028. We are currently at 10%. We also want these schemes to also be subsidized, right? Then for midterm strategies, we're looking at alternative funding. So we're looking at how we can leverage and health levies on sugary drinks, alcohol, and the rest. Can be able to get diaspora investment, also leveraging that, strengthening and also PAT infrastructure, very, very important, and workforce retention. For the long term, we're looking at having National Health Financing Act, having the 10%, reaching the 10% targets by 2028, and reaching the Abuja Declaration by 15% in 2030. So, to do this, we're able to like clearly state out these are what we intend for every particular and stakeholders is expected to do, call them to action. So federal government, we are looking at how we can have expenditure tracking and expand insurance coverage, basically. And for legislation, we ask for the act to be passed, Freedom of Information Act also, and tracking of basically for budget data in particular. For the private sector, investing in health infrastructure, their public-private partnerships. For civil society organizations, we're asking that each and every one of them to advocate for transparency and tracking of health expenditures, for and citizens to prioritize health insurance enrollment, and for the use to leverage technology and digital advocacy to amplify demands for reform. So this was some of what we were able to see. And from what we were able to see, that from the evidence we were able to get and from almost everything that we did, we then developed the campaign itself. That was like what gave us the bedrock for the campaign. I've already discussed this, some of the issues already highlighted in the brief that we developed. So, and since we are an organization that was looking at how will I say, that was youth, our major agent of change, and one of the major issues we realized was that there was a very large knowledge gap, right? You cannot bring in youth into these discussions. Youth have to come in as people that understand these discussions adequately, so that they can actually contribute, not just come and not be able to contribute meaningfully, right? So we want youth to be meaningfully engaged in this. Youth form the largest population of Nigeria. So if we are talking about any major decision that is being made, it's basically made for youth. So why are youth not involved, right? So we're looking at how possibly we can first have like capacity building, whereby when youths are able to know these things, are able to understand health financing as a whole, then we can be able to have like a collective voice among training advocates, and these training advocates in their different communities can have like different groups of people that can come in and be able to hold these people accountable. And with this now, we also are adding up to evidence-based policy products, so that it's policy brief and it's reaching out to decision makers directly and seeing how possibly we can engage them. So, and our message is very clear. So when you hear the Budget for Health campaign, we are not just saying that, okay, you should increase budget. That's not what we are only saying. We are demanding for accountable, transparent, and efficient health financing at all levels. both national, state, and also at local levels in what we do. And majorly, we are looking at how we can engage the community and youth and form strategic partnerships with other coalitions and other organizations to be able to achieve this, and also bringing innovation in what we do also. And for the campaign vision, we are looking at accountable spending, youth advocacy, and permanent coalition, and being formed a multi-stakeholder and health financing coalition, and also community mobilization in almost and across 36 states of Nigeria. And for the campaign itself, we have a very how will I say, a operational structure where you have the advisory board, the youth steering committee. Now, for the functional execution of the campaign, we have the programs team which coordinates most of the parts of the campaign itself. We have the capacity building team, we have communications, and we have grants and partnerships. Now, from last year, June, that was when we launched the campaign during the last Youth Health Financing Forum. Now, so that's the reports that we currently have. So from the Youth Health Financing Forum for last year, we were able to convene 350 participants across 6 countries, and we're able to have key discussions around out-of-pocket health expenditure, health insurance benefits, and innovative grassroots strategies. And from then on, that was when we started and how will I say, giving most of the deliberations that was there, we imputed most of it in our policy brief, and we also launched the Youth Impact Fellowship also. Now, for signing the Youth Impact Fellowship that we launched, that was after the campaign. As I already established our theory of change, how exactly we intend on achieving this. We received about 1,000 applications. We selected 55 fellows. We had 5 months of training, and based on that, we were able to have about 37 dedicated fellows from the fellowship, and we were able to execute 10 projects across the country. So for based on the trainings and what we did with fellows, we also had the health insurance awareness in FCT and cooperative savings for giftship Oyo State, enrollment among traders in Ondo State, malnutrition, budget advocacy. I think most of these were already discussed that in the yesterday, and we had also in Kano State, also in Kaduna State, in Kano State, we have multiple programs in Sokoto, in Lorin, in Akoko, and these are some of the pictures of some of the engagement from our fellows from last year. Then for totally, based on the projects that we implemented, we directly reached around 600 community beneficiaries. And I've already explained that we trained 55 fellows. We went to across 8 different states, and we had 10 different communities. And so, based on that, and most of what we do, the budget and healthcare and crisis, we're able to work on this policy brief, which will be launching, to be shared. We also developed a youth guide to health financing, will be shared, which will be released and by next month, which will help most of your young people that intend in engaging in youth health financing across the country can be able to use that as something that will give them more understanding around how health financing works in Nigeria and how you can engage as a young person. Now, for sustainability and partnerships, most of the collaborations with Budget Nigeria, International Budget Partnerships, Connected Developments, WCA Health, Human Africa, and FAMSA. And we had most of our funding was basically individual and donations and technical support that we were able to get. And for the scalability, we are looking at future continuing most of what we are doing and getting more funding, diversified funding, basically to be able to expand the program. Now, for some of the major implementation challenges that we had for the campaign was more around the resource limitations that we had. There was not enough funding for us to do it. Most of our targets concerning the communities we intend on reaching was quite difficult because of that. And stakeholder engagement was also very, very difficult, and reaching high-level discussions across the year has been quite also difficult for us to be able to do that also. Then sustaining youth engagement, because for most of our capacity building programs and engaging them after and on, and most of young people after a while they get tired, and or we are also looking at how we can be able to put them into working with some of our partners to also involve them in most of the work that they are doing also. For moving forward from this year, and from most of our campaign, based on the lessons we've learned and things that we have seen on the ground, because this is just the first year and these are some of the lessons we've learned. Based on that, we said on expanding community implementation fully and looking at how we can track state and local health budgets and monitor PAT fund utilization and engaging decision makers at that level, at community level, and also scale our networks. And most of our fellows, engaging them, how possibly we can have mentorship networks from those that we are bringing in, and how possibly we can, and those that we already have training the other ones that are to come. So that's all for the major reports that we have, and also the campaign, and basically the campaign and reports for the year. And thank you everyone for being here till this time. The campaign and the policy brief we shared to the chats, and also it also be shared to the group, also to the group. So if you have any questions, you can ask me. I don't know if Okene is here. I don't know if Okene is here.
Yes, I'm on the call.
Okay.
Thank you very much, Joshua, for the launching of the reports. Do we have any questions? Please, if you have questions, thank you. You can give him a round of applause. And well, if there are any questions, please, you can raise up your hand so that we can quickly address that. Any questions? Okay, I think there are no questions at the moment. However, the report will be sent on the group chats soon. So we are gradually coming to the end of the Youth Health Financing Forum 2026. It's been 3 days of brainstorming, and a lot of beautiful ideas have been brought forth to the table. A lot of action points have been given to us youths in order to better health financing and improve reforms in health financing. So as a closing remark, on behalf of the organizing committee of the Youth Health Financing Forum, we would like to express our deepest appreciation to each and everyone who made this gathering possible and meaningful. Over the course of the 3 days, we've engaged in rich, honest, and forward-looking conversations about how we finance health systems that truly serve us, and including us young people, systems that are sustainable and responsive. We've also heard powerful insights from policymakers, from practitioners, from researchers, from development partners, and most importantly, young people. These contributions have sharpened our understanding of the gaps, the opportunities, and the need for smarter investments in youth health. To our speakers and our panelists, we thank you so much for sharing your expertise and challenging us to think beyond business as usual. To our partners and sponsors, your support made this platform possible. To the participants, thank you for your energy, for your commitment over the 3 days. You have reminded us that financial decisions will shape the health and futures of the entire generation. We leave this forum encouraged. The ideas, the partnerships, and commitment generated here should not remain in this room. We call on each and everyone, the government, our partners and sponsors, the society groups, the private sectors, and us young people to translate these discussions into concrete action, to have more accountable and more youth-responsive financing mechanisms, better data, and sustained will. Thank you so much for your presence, for your ideas through the 3 days. Let's continue to work with this same sense of urgency and collaboration that defined this forum. We've come to the end of the Youth Health Financing Forum 2026. Thank you all so much for joining in. We can use our emojis to give a round of applause to celebrate. Thank you so much for your time, for your presence, for your commitment to the theme of the 2026 Youth Health Financing Forum. Before we take our leave, we would want to take a Zoom group photograph. So would kindly ask that we put on our cameras, and then we'll just take a group photo. It will be done in about 2 to 3 minutes. We kindly ask that you oblige us and put on your camera so that we can quickly take a group Zoom photo, and then we end the session.
Sorry, I hope you can hear me. I'm going to take about 6 because my screen can't fit all. So just a minute. It will take 3 minutes, kindly. Sorry.
Mercy, please let us know when you are done with taking the pictures.
Yes, I think I have captured all the participants. Thank you so much for participating in this. I'll be able to share in the group. Thank you.
All right. Thank you once again for joining the Youth Health. It's been an amazing time. Thank you once again.
Thank you so much.
Please do not forget to sign out. I would send the attendance link here and ensure and leave the call on for some minutes. Please sign out. Please don't forget to sign out before leaving the call. Thank you very much. The attendance link has just been sent on the chat box. Please sign out before you leave.